Hello, my name is Kelly Avila, and today I will be discussing an evidence-based care plan designed to improve the safety and outcomes for their patient with anxiety. This patient is a 35-year-old female living in a rural area with limited access to specialized mental health care. The patient experiences symptoms such as excessive worry, restlessness, and difficulty concentrating, and has been diagnosed with anxiety. As a part of an interdisciplinary team, we will explore a comprehensive, evidence-based approach to her care, utilizing remote collaboration among healthcare professionals. Let's begin by reviewing the proposed evidence-based care plan for this patient. The team has identified key areas that need intervention, including pharmacological treatment, psychotherapy, and social support. Based on the psychiatrist's recommendation, we propose initiating medication therapy with selective serotonin reuptake inhibitors, also known as SSRIs, such as sertraline or citalopram, which are first-line treatments for anxiety disorders. These medications have strong evidence supporting their efficacy in reducing anxiety symptoms. Benzodiazepine could be considered for short-term use in acute anxiety episodes. However, long-term use should be avoided due to dependency risk. Additionally, recent research supports the use of SSRIs in treating social anxiety disorder, further enhancing their utility in managing anxiety in this patient. The therapist has been conducting cognitive behavioral therapy, also known as CBT, which is widely recognized as an effective treatment for anxiety disorders. Evidence suggests that CBT is the most effective psychotherapy for treating anxiety, focusing on cognitive restructuring and relaxation techniques to reduce anxious thoughts and physical symptoms. In addition, digital CBT options have shown effectiveness in managing moderate to severe anxiety symptoms. The social worker has addressed the social and environmental factors contributing to the patient's anxiety. This involves stress management techniques, building social support networks, and providing information on community resources. These interventions can help alleviate external stressors and support the patient's overall mental health. Additionally, I recommend psychoeducation for both the patient and her family, focusing on anxiety management, stress reduction, and the importance of a structured daily routine. This approach can improve the patient's coping mechanism and increase family involvement in her care. To develop this care plan, I utilized the Iowa model. This model guides healthcare providers to move from a clinical problem to the implementation of research-backed interventions. First, we identified the clinical problem. Anxiety is in the patient. Then we searched for the best available evidence on treatments for anxiety, particularly focusing on SSRIs, CBT, and social interventions. The Iowa model helped ensure that our interventions were based on high-quality evidence and tailored to the patient's specific needs. We also integrated findings from clinical practice guidelines, such as those from the American Psychiatric Association and the National Institute for Health and Care Excellence, which supports SSRIs as first-line medications for anxiety and CBT as the most effective psychotherapeutic approach. The evidence that most informed our decision include randomized controlled trials, RCTs, showing that CBT significantly reduces anxiety symptoms and prevents relapse. Recent systematic reviews and meta-analysis showing SSRIs' effectiveness in treating social anxiety disorder. Clinical guidelines from the APA and NICE, which recommends combining pharmacological and psychological treatment for better patient outcomes. These sources are credible because they are peer-reviewed from established organizations and are based on rigorous research. By using the evidence, we can offer the patient an integrated and well-supported care plan. The benefits and challenges of the remote collaboration process in this case. Access and expertise. The patient has limited access to specialized care due to her location. Remote collaboration allows a diverse team, including psychiatrists, therapists, and social worker, to collaborate without geographical barriers. This ensures that the patient receives holistic care from experts who might otherwise be unavailable. Timely and regular monitoring. Remote consultations allow the team to monitor the patient's progress and adjust to interventions promptly. Regular virtual follow-ups are essential to ensuring that the patient's care remains effective and dynamic. Continuity of care. Remote collaboration fosters continuous communication among team members, ensuring that all aspects of the patient treatment plan are integrated and adjusted as needed. Some challenges that we may run into. Communication delays. Remote teams may experience communication delays, which may hinder timely decision making. To mitigate this, I recommend using a shared EMR system where updates can be immediately assessed by all members. Technical issues. Remote meetings can also face technical issues such as poor internet connectivity. To address this, we ensure that the team has reliable platforms for video conferencing and have backup communication channels available, such as email and phone calls. Building a rapport. Establishing a therapeutic alliance remotely can be challenging, especially for the patient who may already feel isolated. The therapist's use of virtual CBT has been effective, but continued efforts to enhance rapport and ensure patient feels supported is essential. To overcome these challenges, it is crucial that the team continues to use structured communication models like SBAR, situation, background, assessment, and recommendation, to ensure clear, concise, and effective exchanges of information. In conclusion, the evidence-based care plan for this patient with anxiety incorporates pharmacological treatment, cognitive behavior therapy, and social support. By using an EBP model like the Iowa model, we were able to ensure that our interventions were grounded in research and tailored to the patient's unique needs. Remote collaboration enables healthcare providers to overcome geographical barriers and provides timely, comprehensive care. However, it is important to address challenges such as communication delays and technical issues to improve the care process. The evidence-based intervention proposed here have been shown to improve patient outcomes, and with continuous follow-up and teamwork, we can ensure the patient's safety is managed effectively. Thank you for watching.